If you're pregnant or you're thinking about getting pregnant, this one is for you. I'm Dr. Gigi, and this is your 1% Better Tip of the Day. So I just want to go over some general tips that you may not have ever heard of. A lot of pregnant moms know that you need folic acid, and one of the most main nutrients that you need. But also there's a few others that are really important, and those are calcium, vitamin D3, and iron. Those are really important to have in your diet during your pregnancy. You can get a good prenatal. Garden of Life has a raw prenatal that it carries that is very good and has all the nutrients you need, but there's obviously other ones that are out there. Just make sure when you're picking a prenatal that there's no added things that you don't necessarily need, or if there's any words that you don't really understand what they mean, look them up. Make sure that it's a safe product for you. Another thing to consider is what you use as personal care products, household products, things like that. Why? Because a research that they did back in 2004 found that in the blood of the umbilical cord, there was about 200 different industrial pollutants and chemicals in that blood, which that goes directly to the baby. So where those pollutants come from are from things that we breathe in, whether they're from like cleaning products or things that we put on our skin, like different moisturizers or makeup, but even the things that we eat, if they're not organic, if there's pesticides on those, all those things come into our bodies, and then they have to get expelled somehow. And during that process, some of those pollutants go actually into the umbilical cord, and they can get transferred to the baby. So using things that are organic, trying to find personal care products that are more natural, and also changing some of our cleaning products that are very toxic is a good idea while we're trying to get pregnant or while you're pregnant. Last thing is chiropractic care. Yes, chiropractic care is great for pregnancy, and a lot of people don't know that. It is a little bit different than our typical adjustments because we work more on the pelvis. I am Webster certified, so that's a specific certification to be able to analyze a pelvis without even needing to take x-rays or anything like that. And we work around the soft tissues and the muscles and the ligaments that are around the pelvis area to make sure that the pelvis is nice and balanced, so that it can help during pregnancy to make it a lot easier, less pain, know that I'm not having that sciatic pain down the legs or the low back pain. It also helps with in possibilities of a breech baby, because we're able to take that intrauterine constraint and relax those muscles around the uterus and help for the baby to have enough room to turn. So we can definitely help even with the labor time too. They have shown with research, if you're getting chiropractic care while pregnancy, it really shortens down the labor time and it makes it a lot easier. So there you have it. Those are some tips to have in mind if you're thinking of getting pregnant.